Let's discuss liver patterns, liver yin deficiency. Concept, this is due to yin deficiency failing to moisten and nourish the liver. The pattern of deficiency of liver yin results from consumption of yin fluids in the liver. Further development of liver yin deficiency will fail to restrain yang, leading to a deficient heat pattern affiliated with liver yang hyperactivity. Clinical manifestations, there is dizziness, tinnitus, dryness of the eyes, blurred vision, tidal fever, red cheeks, dry mouth and throat, feverish sensation in the chest, palms and soles, night sweating, creeping of the limbs, small involuntary movement of the limbs, a dull burning pain in the costal and hypochondriac regions, red tongue with liquid fluid, and a taut, ready, and rapid pulse. Key symptoms, malnutrition of the head, eyes, sinews, and vessels. The liver channel complicated by yin deficiency generating a deficient heat pattern. Here, the table of analysis of liver yin deficiency pattern. First, fails to moisten and nourish the head and eyes. There is dizziness, tinnitus, dry eyes, blurred vision. Fails to nourish the liver channel and deficient fire, enduring this burning pain in the costal regions. Fail to nourish sinews and vessels. There is creeping sensation of the limbs. There is loss of nutrients and moisture from the head, eyes, sinews, and the liver channel. Next, yin fails to restrain yang, deficient heat harassing internally. There is feverish sensation in the chest and palms. Deficient heat endures yin qi. There's night sweating. Deficient heat rises upward. Red cheeks. Failure to raise yin fluids upward. There's dry mouth and throat. Red tongue with scanty fluids, not ready, wiry, and rapid pulse are symptoms of liver yin deficiency and deficient fire harassing, which is the yin deficiency. For the summary of liver yin deficiency, the etiology, a diet lacking in nourishment, excessive use of drugs, chronic illness, too much sexual intercourse, overexertion. Underlying accompanying pathology, kidney yin deficiency, liver blood deficiency, may allow yang to become hyperactive and even wind to steer internally. Signs and symptoms, there is dizziness, headache, blurred vision, visual floaters, dry eyes, poor night vision, scant menstruation or amenorrhea, numbness and tingling of limbs, insomnia, dull pale complexion, with redness around cheekbones, muscular weakness, cramps, brittle nails, very dry skin and hair, depression. For the pulse, floating and empty, tongue is normal color and filled. Treatment principle is to enrich yin, nourish blood. For the acupuncture treatment, we use bladder 17 with moxa, it supplements blood. Bladder 23 supplements kidney to produce yin. Spleen 6 regulates liver, nourishes yin. Stomach 36 nourishes yin and blood. Kidney 6 nourishes yin, clears empty heat. Bladder 20 supplements spleen to produce blood. Liver 8 nourishes liver yin and blood. Kidney 3 supplements kidney yin. Ren 4 nourishes kidney yin. Extra point Yu Yao benefits the eyes. Relevant advice, it is essential that the person who is liver yin deficient gets enough rest and relaxation. This means that they must have an ample sleep and go to bed early at night. They must not work too hard nor spend too much time watching television and staring at the computer screens. They should avoid stimulants such as coffee, which would stress their system. Alcohol is not good for them because it is both spreading and warming in its energy and creates heat in the liver, which can induce liver yin. Dynamic activities such as aerobic or action sports will be detrimental and should be discouraged because they will further consume yin. The person should instead cultivate gentler and more meditative forms of motions such as Qigong, Yoga, and Tai Chi. Massage and meditation are especially beneficial because they increase peace and tranquility in the body and thereby benefit yin. The client should try to avoid foods that are stimulating and warming. This includes coffee, alcohol, dark chocolate, and hot spices like chili. Generally, concentrated proteins, cereals, and root vegetables nourishes yin. Green leafy vegetables will be especially good because the green color will resonate with the liver and thereby directly tonify liver yin. Using a lot of water in the preparation of food, especially soups and stews, is preferable to baking things in the oven, which is more drying. Oil and products that have a high oil content, such as nuts and seeds, will nourish and moisten yin. Foods that specifically nourish liver yin are artichokes, beetroot, tomato, avocado, seaweed, dates, grapes, lemon, nettles, olive oil, lima beans, mung beans, kidney beans, pine nuts, sesame seeds, tahini, crab, oysters, beef, liver, and rabbit. Thank you for your attention.